So the session on cancer genetics was a really exciting and interesting session. It actually sort of spanned the gamut of some of the different key issues that we're addressing as providers who are involved in cancer risk assessment and taking care of individuals with a mutation or pathogenic variant in a high penetrance gene. The first session really focused on a vexing problem for us, which is the identification of these variants of uncertain significance. These are fairly common, and they're more common in less well-studied populations. So they're as testing becomes more broadly available, it's something that we see increasingly these days as well. And when you have a result like that, when you have a variant of uncertain significance, we can't really pinpoint for the patient whether that's actually a pathogenic variant or a benign polymorphism. Statistically, the greatest likelihood is that it's a benign polymorphism, but occasionally they end up being pathogenic variants. But you end up waiting, or the patient waits for years to really find out and to have them reclassified. So Dr. Fergus Couch presented his results where he was able to analyze the BRCA2 gene and determine whether variants at different positions throughout the gene, whether they would be associated with a pathogenic variant versus a benign polymorphism. And this theoretically, the other great thing about it is that this, defines it for the gene. So a lot of what we do in medicine in general and in cancer genetics really tends to be weighted more towards individuals of European descent, but this would be agnostic to one's ancestry or ethnic background, and would be really, really helpful for us to have that information in real time as a VUS is identified, to be able to say, hey, this is one that means something, or this is one that doesn't. So that was really exciting. And the concept would be that the technology developed could be applicable to other genes. You just have to go through it and identify it. So it might provide us as clinicians and as if you have individuals who are pursuing testing, a much more informative result for them. One of the other sessions focused on a new model of cancer risk assessment that incorporates a variety of both the standard risk factors for individuals as well as genetic makeup beyond just the high penetrance genes. So again, this is something that would have wide applicability and would be great to get into the clinic for us to be able to better assess somebody's risk. And then the final presentation really was more of a deep dive on these reversion mutations that account for resistance to treatment with a PARP inhibitor for BRCA1 and BRCA2. So again, trying to get at aspects of how to adequately assess somebody's risk, both by better being able to define what a VUS is, how to do better risk assessment models, and then the therapeutic aspect of, let's identify the mechanisms for resistance for reversion mutations so that we can better understand that and potentially be able to develop better therapies to overcome that.